So let's talk about dark underarms. It's something a lot of people deal with, but is it just a cosmetic thing or could it be a sign of something deeper? In this explainer, we're going to uncover what's really going on and what your skin might be trying to tell you. You're probably asking yourself, why are my underarms dark and what can I even do about it? Well, the good news is there are answers. We're about to break down all the causes, the solutions, and this is the most important part, the health signals you absolutely should not ignore. All right, first up, what exactly are we talking about when we say dark underarms? Let's demystify this whole discoloration thing. First things first, if you have darkened armpits, you are absolutely not alone. It is so common and often a totally natural thing. There is no reason to feel self-conscious. It's just one of the ways our bodies can react to different factors. Okay, so if you want to get technical about it, the medical term is axillary hyperpigmentation. Sounds super complicated, right? But all it really means is that your body is making a little too much melanin. That's the pigment that gives our skin and hair its color, specifically in your armpit area. And a lot of the time, this hyperpigmentation is actually a sign of a specific condition called anthosis nigricans, or AN for short. This is what causes those classic, dark, kind of thickened, and sometimes even velvety patches of skin, not just in the underarms, but in other body folds too. Okay, moving on to section 2, the main culprits. So what's actually causing this? Well, it really helps to think of it in two main camps. Simple, everyday irritation on the outside, and deeper, internal signals coming from your body. So think of it like this. On one hand, you've got your everyday irritants. Things like shaving and deodorant, stuff that's just rubbing against the skin. But on the other hand, you've got underlying health factors. And this is where we're talking about deeper signals from your hormones and your metabolism. Let's tackle the irritants first. So what are these everyday triggers? We're talking about the usual suspects. Shaving, of course, friction from clothes that are a bit too tight, a buildup of dead skin cells, and yep, even some of the ingredients in your deodorant, like alcohol or strong fragrances. Over time, all this constant irritation can lead to something called post-inflammatory hyperpigmentation. Okay, now let's talk about the other side of this, and honestly, this is the part you really need to pay attention to. The internal health signals. This is really important. Dark underarms can actually be one of the first visible signs of insulin resistance, which is a big red flag for type 2 diabetes. They're also linked to hormonal issues like polycystic ovary syndrome, also known as PCOS, and they can even be a side effect of certain medications. All right, section 3, solutions, starting right at home. We've dug into the why, so now let's get into the what to do about it. Here's a simple action plan you can start like today. The best approach here is all about a simple, consistent routine. Nothing crazy. First, just wash gently with a fragrance-free soap. Second, exfoliate smartly, and by that we mean using a mild chemical exfoliant a few times a week, not some rough, gritty scrub. And third, moisturize every day to soothe the skin and cut down on irritation. So, when you're standing in the aisle at the store, what should you be looking for? For deodorants, try to go for ones that are hypoallergenic and alcohol-free. And if you're looking at over-the-counter creams to help lighten things up, keep an eye out for gentle, proven ingredients like kojic acid, vitamin C, or niacinamide. These can help fade dark spots over time without causing more irritation. Okay, section 4, when to see a pro. But what happens if you're doing all the right things at home and it's just not enough? Well, that's your cue that it's time to level up and see a professional. And this brings us to what might be the most important question of all. Could your dark underarms be a sign of something more serious? The most important thing to know is it can sometimes be related to diabetes. This is exactly why you should never, ever just write this off as a cosmetic thing. So what can a dermatologist do? Well, they have a whole range of professional treatments, from prescription creams with things like retinoids to in-office procedures like chemical peels, laser therapy, or even microdermabrasion. They've got options, all designed to safely lighten and resurface the skin. So let's just do a quick side-by-side of the options, right? At-home care is great. It's easy on the wallet, but results can be pretty slow. Medical treatments, they're way faster for sure, but they do cost more, and of course, you need a pro. And prevention, well, that's the long game. It's all about consistency. And for our final section, keeping underarms clear. So let's say you've addressed the cause, your skin is looking better. How do you keep it that way? Let's talk prevention and long-term care. Honestly, a few simple habits can make a world of difference. Try wearing looser, more breathable clothes to cut down on that friction. If you're a shaver, please always use a lubricant like shaving cream and a fresh blade. It helps so much. And since there's often a link between obesity and acanthosis nigricans, maintaining a healthy weight is probably one of the single most effective things you can do to prevent this. So we'll end on this thought. Dark underarms, a lot of the time, they aren't just a skin issue. You can almost think of them as a conversation your body is trying to start with you. So the question I want to leave you with is this. Beyond the surface, what is your skin trying to tell you?